The latest Phase 2 heightened alert period was slated to end today, but as you know, some rules like on dining out have already been relaxed.
And at the last press conference, the Covid-19 task force announced that from tomorrow, the capacity limit for large events will increase and more employees will be allowed back to the workplace.
Let's bring in Professor Dale Fisher, Senior Consultant at NUH's Division of Infectious Diseases. Welcome back to the show, Professor. Given the current vaccination rate and number of people in ICU, Professor, do you expect further easing in other areas, perhaps say in social gatherings?
Yeah, hi, thanks for having me back. Certainly the authorities couldn't have asked for more from the numbers. The total number of cases is down, the number of clusters is falling, the number of people in hospital has fallen, particularly as we've been able to move people out into the care facilities. There's only 6 people in intensive care today, I think, less people on oxygen. So actually, if it was about the numbers, then really the course is pretty clear. Furthermore, vaccinations have continued at a very high rate of over 50 or 60,000 a day. So the vaccination numbers are extremely enviable, I would imagine, by other countries with 82% of the population having one jab and 76% altogether are being fully vaccinated. So these are numbers other countries are aspiring to, and we are there and going past it. Even the 70-year-olds that we were worried about until recently, they're now 86% one jab. So kudos to everyone that's made that happen.
Well, Prof, at the same MTF press conference about 2 weeks ago, Health Minister Ong Ye Kung said that by early September, 80% of Singapore's population is expected to be completely vaccinated, and that's when travel will resume. And
Trade and Industry Minister Gan Kim Yong told Bloomberg this week that Singapore plans to set up pilots next month to allow vaccinated business travellers from some countries to enter.
So, Prof, let's bring you back in. As Singapore shifts away from a zero-case strategy and transitioning to living with endemic COVID-19, how would this stance affect border control policies with other countries which, are still emphasizing the zero-case strategy?
So firstly, I would argue that Singapore's actually ever had a zero-case strategy. Certainly we've had many 0 days and we've wanted the numbers as low as possible. But there hasn't been the same panic when we've had cases and clusters over the last year and a half, at least when the numbers were low, because as you've seen in fact, as you saw in New Zealand yesterday, right, the one case caused a huge lockdown and mass testing, and we see these happen in Australia and China as well. So we've never had that kind of strategy. Our strategy has been more of keep the numbers low, keep the restrictions kind of even with the mask wearing and the numbers of people that can gather, and that's been the strategy here. Going forward, though, it's most important to remove the restrictions which have the greatest impact in terms of society and the economy. So society is about people getting together for important gatherings, whether it's birthdays or weddings and things like this, religious, cultural events. These are important socially, and obviously economically, businesses being allowed to open and particularly travel needs to get going, and business travel as well. So these would be the restrictions I would expect to gradually ease. I think Singapore has a very nice graduated approach to opening. It'll be one step at a time, have a look around, make sure everything's going okay, take another step. So back to the question, I do expect the travel restrictions to start easing. Those countries that are zero tolerance of cases, though, they won't actually want us. If they've still got a zero case tolerance, then we will still have to go do quarantine going there, because we're going to have transmission and we're going to see our numbers go up. But because we're so well vaccinated, it's going to be of a mild disease. So we'll be more likely to open up to countries, and open up, I mean, no quarantine at either end, we're more likely to open up to countries that actually have disease than countries that don't want any disease, because they'll want us to quarantine going in.